Athletic trainers are allied health professionals who specialize in working with physically active populations. The athletic training scope of practice can be broken down into 5 domains: risk reduction, wellness and health literacy; critical incident management, which is emergency care and immediate care; assessment and evaluation and diagnosis of injuries and illnesses; therapeutic interventions for managing injuries and illnesses, including rehabilitation, as well as healthcare administration and professional responsibilities. Athletic trainers practice in a variety of settings working with physically active individuals. Traditionally, these fall under working with athletes in kind of your sports setting, traditional settings such as secondary school, college, universities, working with professional athletes, or in a rehabilitation clinic. Newer emerging settings for athletic trainers include working in hospitals and physicians' offices, working with performing arts individuals, including those in the circus, musical theater, ballet, working with individuals in the military, working with public safety individuals, including firefighters, police officers, and FBI agents, as well as working in a variety of industry settings. In order to become an athletic trainer, individuals must complete a master's degree in athletic training from a CATE-accredited university. They must sit for and pass their Board of Certification exam, and they oftentimes need to apply for and maintain state licensure in order to practice in their state. Additionally, athletic trainers must maintain continuing education and their emergency cardiac care certification.
Health Service Administration students are training to become the people that care for the people that care for the people. They operate on the business side of healthcare to make sure that organizations are running as efficiently and effectively as possible. They will engage in interprofessional teams, and they also must have a desire to lead organizations from a place of a heart-centered leadership in order to get other healthcare staff to follow their lead. Our students graduate with an undergraduate degree in health administration and a minor in business. Many go on to pursue a master's degree, perhaps a master's in healthcare administration, a master's in public health, an MBA. Some go on to become nurses, occupational therapists, respiratory therapists. Really, their careers are wide open for their advancement. No licensure is required of healthcare administrators except for in long-term care administration. Finally, our students will eventually go on mainly to work in doctors' offices, hospitals, long-term care facilities like nursing homes, or assisted living facilities. They might be working with pharmaceutical companies, medical device sales, and recruiting companies.
There are over 4 million registered nurses across the United States. As the most trusted profession, nurses coordinate population and client-centered care across the lifespan. Nurses are concerned with human response to illness and wellness. Wherever there is someone in need of care, nurses work to identify and protect those needs. Nurses are educated in 2 levels. Entry level is where a candidate receives competence and is prepared to take the registered nurse license exam. Advanced practice builds on entry-level practice competency and further develops additional certification and competencies in advanced practice nursing. Advanced practice nurses include family nurse practitioners, certified registered nurse anesthetists, clinical nurse specialists, and nurse midwives. Nurses work and practice in a variety of settings across the healthcare continuum. This image shows where most nurses at the entry-level practice, which is the acute care setting. Wherever a client is in need of care, nurses meet that need, whether it's the home, a clinic, an inpatient setting, or outpatient setting. You will find nurses everywhere.
Physician assistants, also known as PAs, are an integral part of the healthcare team. PAs are able to provide their patients with a full spectrum of care, which includes taking medical histories, performing physical exams, ordering and interpreting laboratory tests, and diagnosing illnesses. They also develop and manage treatment plans for their patients, prescribe medications, assist in surgery, and counsel their patients on preventative health and wellness. PAs are educated at the master's level, so those students applying to the program must have a bachelor's degree and completed prerequisites. Once enrolled, a typical PA program extends over 27 continuous months and begins with classroom instruction, including basic medical sciences. This is followed by rotations, which are at least 2,000 hours of supervised clinical practice in medical disciplines, including family medicine, internal medicine, general surgery, emergency medicine, and more. As well, all practicing PAs must maintain certification. To do this, PAs are required to pass a certification exam every 10 years, while also completing 100 hours of continuing education every 2 years. PAs can work in most work settings, with the majority of those working in outpatient clinics or the hospital. As well, PAs can practice medicine in all healthcare settings, including primary care, internal medicine, surgery, and many specialties.
Welcome! I'm delighted to be here to talk about the profession of nutrition and dietetics, our scope of practice, our practice settings, and our educational pathway. With regard to our scope of practice, we work in clinical nutrition, community nutrition, as well as food service and clinical management. Within clinical nutrition, we provide medical nutrition therapy to our patients and our clients in a variety of settings following the nutrition care process. With regard to community nutrition, we see individuals and groups in order to promote health and well-being while preventing and managing chronic disease. And in the management setting, we work in a variety of different types of settings in order to plan healthy menus to support the health of our clients. We work in a number of settings, including hospital organizations, outpatient clinics, as well as long-term care settings. We also work in private practice, as well as retail settings, corporations, and at the university setting level. Lastly, as far as our education, we need to start with an undergraduate degree, which can be in any major, providing we take certain prerequisite courses, such as biology, chemistries, including organic and biochemistry, foundational nutrition courses, and also mathematics. Starting January 1 of 2024, we also now need to secure a graduate degree, which includes not only coursework, but also experiential learning on site.
I'm here to talk to you about occupational therapy. Most people don't know what we do. When you meet an occupational therapist, we're likely to ask you, what do you need to do, what do you want to do, and what do other people expect you to do? We're going to ask you where you need to be doing those things and when you're going to be needing to do those things. To enter into the career of occupational therapy, there's 2 current points of education. You can earn either a master's degree or an entry-level doctorate. After you complete your clinical fieldwork and your education, you would sit for a national board examination and then apply for state licensure. Like all health and human service professionals, there are continuing education and professional development activities you must complete to maintain your competency. Our scope of practice focuses on occupations, the environments that people are performing them within, and the person themselves. We look at completing evaluations, designing client-centered or personally tailored interventions to help people achieve the things that they want and need to do in their daily lives. Where can you find us? As you can see, there's a variety of practice settings where occupational therapists work, including people's homes, out on the road, in hospitals, in communities, both in terms of physical and mental health facilities as well. Occupational therapy is a vibrant and rewarding career. We hope you look into it more.
As speech-language pathologists, we serve individuals across the lifespan and across what we refer to as the Big 9, which are our diagnostic categories. You can see here that includes things such as articulation and phonology, fluency or stuttering disorders, swallowing, as well as other areas such as alternative communication and cognitive disorders. Because we serve individuals across the lifespan, you will see us in pretty much any setting that you're working in. We treat our youngest patients in the neonatal intensive care unit. We also work in schools and private practice or outpatient clinics. And then we also work in medical settings, including skilled nursing, inpatient and outpatient rehab, as well as the hospital and acute care settings. In order to become a speech-language pathologist, you have to earn a master's degree in the field and pass the National Licensure Exam, or the Praxis, and complete a 9-month clinical fellowship. And then in order to maintain your certification, you have to complete continuing education, and some professionals choose to go on for a clinical doctorate or a PhD in the field.